I love working with Alzheimer's patients because they give me a challenge. It's a pleasure to work with the patients, but not only the patients, but the families as well. I like working with families because it gives me a chance to know them. I've had the pleasure of working with one family for over 2 years now. It's been a pleasure because every time they come in, they always want to see what's the latest with my horseback riding adventures, what's the latest with my one horse, Dusty. And she could never remember his name, and every time she came in, she said, what's your horse's name? And I'd say, it's Dusty. You know, that's the way it is with Alzheimer's patients. You repeat a lot of different things. So one day she came in and she was oh so excited. She said, I remember his name, it's Dusty. And she was so happy, and her family was so happy because it was a big thing for her. She finally remembered his name. And even when she was out of the study, her family's request said, you know, could we bring my wife out just to see you and Dusty and ride? Because she just asks about you all the time, and we really would love to do that. So that's something we're gonna do, because you know that means a lot to me that they want to keep in contact with me, because I've made a difference in their life. And to me, that's important, to make a difference in my patients and my family's lives.
There's a warm wind blowing, and it makes me feel alive. There's a whole world waiting for the things you never tried. Everything is changing, I can feel it in my soul. There's a voice inside me telling me it's time to go. Open your eyes, baby, this time it's all that you need. Open your eyes, see what you find when you start to believe. Open your eyes, maybe this time it's all that you need. Open your
Research nursing is a unique specialty, unlike any other area in nursing.
Research nursing offers unique challenges for all of us.
Whatever you have done in the past in nursing, whatever experiences you have learned along the way, you will utilize them in this specialty area.
Whether it be working with a population of normal healthy volunteers or patients with advanced disease, we have unique skill sets, and there's a lot of training and development that goes into working with all of our studies.
We kind of wear a whole barrage of different hats during a day. And that's actually one of the things that I really like about being in research.
The nurses are constantly challenged, and we're continually learning on a daily basis, and that's what makes our job so rewarding and exciting.
It's very rewarding. There's something new all the time. It gives me an opportunity to use the skills that I've learned over the last 14, 15 years.
It's a very cool arm of nursing. And the coolest thing about it is we are in the forefront. It's always changing, and we're always contributing to modern science.
Our mantra in the Phase 1 Center is hugs and drugs. We like to provide patients not only with the clinical support because of the uncertainty of these drugs, but we also like to provide them with support. And so before any of our patients leave to go home for a day, they get a hug. so that they feel more comfortable coming back. And they know that we're all here for them, and if they have any questions or concerns, that they feel very comfortable with us. What I'm excited with this job is that I was able to be part of some new cancer therapies. It's very exciting to hope that one of these drugs is going to work in treating a cancer that maybe didn't have very good treatment options to begin with. I really enjoy the patient population, and I really am excited about giving these new drugs to patients and having them work.
People do come in with some anxiety if they have not done research studies. It's always what's going to happen now.
I put participants at ease.
Because a lot of people don't really know what research is all about.
We're trying to explain to them in common terms what's going to happen to them.
They are volunteering to do this research study. They are, donating their time, their body to these research studies. So I like to make them feel as comfortable as possible. Most
of the time, after we're done talking to them and go step by step, by the end of it, they're actually pretty content that they enrolled in the study. And hopefully it's going to help the future generations.
When the researchers come to the table with the community, they have to understand their fears and to be able to talk to them and answer their question completely.
We do so many things just because we've always done them that way, and it's so important to be able to do them because we know it's the right thing to do, and we need data to do that. And so that's really what research is all about, is asking those questions that we need to get answers to.
When you mention the word research, they automatic thinking that they're guinea pigs. As a community-based research and advocate, I want to ease their fear, and at the end, they feel like they contribute now and in the future.
We're so aware of the importance of diverse perspectives, and we first of all respect and honor the patient, the participant, and I think that gets communicated, but I think we're also in a position to be able to let them know that their safety has also been protected, that they're not going to be taken advantage of, but that we value so much their willingness to partner with us to get the answers to these important questions.
It's like a breath of fresh air. I needed an opportunity that was new and exciting and rewarding, and I found it in research.